The prostate is a small, walnut-sized gland located just below the bladder in men. Here you can see the bladder, and this is the prostate gland. It generates fluid that constitutes part of semen. As men age, their prostate may enlarge. Benign prostatic hyperplasia, BPH, occurs when the prostate grows large enough to cause issues. It's important to note that BPH is benign, meaning it is not cancerous and does not lead to cancer. However, BPH and cancer can coexist. If you want to learn more about how to manage BPH and keep your prostate healthy, make sure to like this video, subscribe to our channel, and stay until the end for a valuable tip you won't want to miss. First, let's discuss the risk factors. Various risk factors contribute to BPH, with some individuals at higher risk, such as men over 50 years old, since the risk of BPH increases with age. Men with a family history of BPH, particularly those whose fathers had the condition, are also at higher risk. Additionally, overweight or obese men, those who are not physically active, and some men with erectile dysfunction are more likely to develop BPH. Next, we will cover the signs and symptoms of BPH. The initial sign of benign prostatic hyperplasia is urinary frequency, which is the need to urinate frequently, particularly at night. This happens because the enlarged prostate exerts pressure on the urethra, making it harder for urine to pass from the bladder. Consequently, the bladder contracts more often, causing men with BPH to feel the need to urinate frequently, even when the bladder is not completely full. Urinary frequency is one of the most common symptoms of BPH and can indicate the early stage of the condition. However, it can also result from other issues, such as urinary tract infections or bladder stones. Another common symptom of benign prostatic hyperplasia is urgency, characterized by a strong and sudden urge to urinate, even when the bladder is not full. This occurs because the enlarged prostate puts pressure on the urethra, impeding urine flow from the bladder and creating a sense of urgency. Men with BPH might feel the need to urinate immediately and may struggle to delay urination. Urgency can disrupt daily activities and lead to incontinence or urine leakage if the person cannot reach the bathroom in time. It can also cause anxiety and decrease the quality of life. Urgency is a common symptom of BPH and can signal the early stages of the condition, although it can also be caused by other issues, such as urinary tract infections and bladder stones. The flow of urine may be weak or slow, particularly at the onset of urination. This weak stream can hinder the complete emptying of the bladder, resulting in urinary retention. A weak urine stream can be frustrating and may leave one feeling as though the bladder is not fully emptied. It also raises the risk of urinary tract infections, bladder stones, and potentially incontinence or urine leakage. Interrupted urine flow is another significant indication of an enlarged prostate. Urine flow may start and stop multiple times during urination, suggesting a partial blockage of the urethra. This issue can also be caused by prostate infection or inflammation, nervous system disorders, pelvic muscle problems, and sometimes as a side effect of surgery. Another important sign is the inability to empty the bladder completely. Some men with BPH may not be able to fully empty their bladder, leading to urinary retention. Even after urination, dribbling can occur. This happens because the enlarged prostate exerts pressure on the urethra, making it harder for urine to exit the bladder. Consequently, some men with BPH may experience dribbling after they have finished urinating, feeling as if there is still urine left in the urethra. Dribbling can be embarrassing and may lead to incontinence or urine leakage, increasing the risk of skin irritation and urinary tract infections. Reiterating an important point, BPH can elevate the risk of urinary tract infections due to urine accumulation in the bladder. Men with BPH may also experience pain or a burning sensation while urinating. Another critical sign is the presence of blood in the urine, known as hematuria. The color of the urine can range from light pink to deep red. Sometimes the presence of blood is only detected through a urine test if the amount is small and not visibly noticeable. However, in more severe cases, the blood may be noticeable and accompanied by pain or discomfort during urination. It's essential to keep in mind that blood in the urine can also indicate a more severe underlying condition, such as prostate cancer. Lastly, BPH can also lead to sexual problems, including erectile dysfunction. It's important to note that not all men with BPH will experience all of these symptoms. Some may have only a few. If you are experiencing any of these symptoms, it is crucial to consult a doctor for evaluation and treatment. There are also several ways to boost your prostate health naturally. We invite you to watch a more detailed video on this subject. Check the first pinned comment for more information.